How are you doing today? With you, Dr. Hamid, an ECV certified physician, and we are going to talk today about a high-yield case for the pharma of the USMLE Step 1 exam. We've got a 23-year-old woman with a homozygous sickle cell disease, hemoglobin S. She experiences frequent vaso-occlusive crises. She is currently taking folic acid supplementation and will start hydroxyurea. And our question asks, what is the primary mechanism by which hydroxyurea alleviate her symptoms? Pause the video and think about the correct answer. And the correct answer is D, which is increased fetal hemoglobin senses. First, to tackle this case, we need to talk about the different types of hemoglobin. We've got hemoglobin A, hemoglobin A2, hemoglobin F, and hemoglobin S, the diseased one. So hemoglobin A1 contains the 2 alpha and the 2 beta chain, hemoglobin A2, 2 alpha and the 2 delta chains, hemoglobin F, 2 alpha and the 2 gamma chains, and sickle cell disease, which hemoglobin S, which contains S chains. And the problem lies that hemoglobin S, when you have like sickle cell disease, there is like missense mutation, and you will have like substitution of amino acids instead of having glutamic acid. You're gonna have valine, and this is like the pathophysiology behind the sickle cell disease, which is substitution of glutamic acid, and instead we're gonna get valine instead of glutamic acid, and we no longer have the nice hemoglobin A, but instead we are having hemoglobin S. And the problem with hemoglobin S is that it's gonna clog in the circulation. So whenever you have deoxygenation or you have illness or fever, and the hemoglobin S is not gonna uh, like run smoothly through your blood vessels. Instead, it's gonna clog in your peripheral blood vessel, and you will have like multiple vaso-occlusive crises. And this problem is more evident if you have like hemoglobin SS instead of like being heterozygote. This may be asymptomatic, and the options here is first the reduction of red blood cell dehydration. Correct, wrong answer. Hydroxyurea has nothing to do with cell dehydration. And the second option, direct inhibition of hemoglobin S polymerization, also a wrong answer. Hemoglobin S doesn't directly inhibit the hemoglobin S polymerization, and instead it works at the level of the transcription factor. So you have to know that it works at the level of the transcription factor. So instead of having like the beta chains, this is the beta chains of hemoglobin A, you will have the gamma chains. So you will have like hemoglobin F. So the hemoglobin F is not like hemoglobin S, but it can like run smoothly in your circulation. So it is gonna ameliorate the symptoms of sickle cell disease. And the answer C, enhanced hemoglobin A2 production. So when you have like enhanced hemoglobin A2 production, it is beneficial for the cell disease people, but it is not the mechanism of action of hydroxyurea. Hemoglobin A2 have like 2 delta chains, so it doesn't have the beta chains where the problem lies. So have to know the problem lies in the beta chain, and the beta chain is substitution of glutamic acid. Instead, you will have valine, and this is the problem. So hemoglobin A2 doesn't have this problem, so it is beneficial for us, but it is not the hydroxyurea mechanism of action. And the correct answer is D, which is increased fetal hemoglobin F synthesis. So instead of having beta chain, you will have like gamma chain, and you have hemoglobin F, a nice hemoglobin F, which is gonna like run smoothly, and this will decrease like the vaso-occlusive crisis, and elevated antioxidant level in the red blood cells also like wrong answer. So you have glutamine, which is transferred into glutamic acid. It's like antioxidant, and it is going to be beneficial for sickle cell disease people, but it is not like the first choice here. The first choice is hydroxyurea, and after you give hydroxyurea, if you still have like vaso-occlusive crises, you may give glutamine, and this works like with antioxidant properties. And the question asked about the mechanism of action of hydroxyurea. So this is the wrong answer. The last choice here is the stimulation of erythropoiesis. This is a wrong answer. Essentially, it's gonna like make the problem worse, because when you stimulate erythropoiesis, like you're gonna increase your like red blood cells, and you will have like more vaso-occlusive crisis. So you have to know that hydroxyurea is actually an anti-metabolite agent. It inhibits an enzyme called ribonucleotide reductase. So this is the primary action of hydroxyurea. So it is gonna inhibit the rapidly dividing cells, and the collateral action or the side action, which is like as a transcription factor. This is the action is beneficial here, which is increasing the transcription of the gamma chains and increasing the hemoglobin F. So this is all for today. I hope you guys enjoyed the video, and see you in next videos.